Africa in Motion is coming with a new topic. In our health education, we are going to talk about 12 methods of contraception. 12 methods of contraception. All these methods will be around female reproductive system and male reproductive system. On the female reproductive system, we are going to see some which will work here on the ovary, others will work in the uterus inside, other mode will be on the tube, fallopian tube, and others will work in the vaginal canal. While on the male, we will see a method that is used on cutting this tube. This presentation, we are going to divide it into two, where we are going to see more on the surgical procedures in the first part, then other methods, we see them in the second part. So when we talk about methods of contraception, they are different. We need to know that they are different, but some of them are permanent, others are not permanent. The permanent one, for example, is vasectomy or tubal ligation. That's it will be a surgical procedure. Long-acting reversible contraceptions are such as what? Implants, like what we call intrauterine device. That one is long-acting, but it is reversible. You can remove it. Hormonal contraceptives such as pills and injections. The pills that are used and injections that are used every 2 or every 3 months. The barrier methods such as condoms. There is a female condom, there is a male condom. Now there is also emergency contraception in case you think that you're about to conceive or you forgot to take your pills. Then there is what we call emergency contraception. Also there is what we call fertility awareness. Check your time where your fertility is likely to be present, okay? Or you know that you had sex without condom and your wife or your partner might get a conception. Then you need to be aware of that. Now you can apply methods that will help you to prevent conception. So male sterilization, if you start on the male side, there is what we call cutting the vas deferens, the tube that transports semen. This method is effective at 99%. What is it? If you see the male reproductive system, you can see the testis here, and there is these tubes, both sides on left and right tube. They will come this way along and it will enter here. Then it will meet the vesicles, the seminal vesicles, and it will enter through the prostate gland and to continue this along. So when it is being cut, you cut it before the prostate, before the prostate and before the seminal vesicles, because once it is cut, here it is more clear, once it is cut, all the sperms produced in the testis will not be able to cross and come. You see, there is a discontinuity. However, ejaculation is still possible, because ejaculation, the fluid from the prostate gland and the seminal vesicles will still come out. So ejaculation is possible even though this tube was cut. The only difference is the sperm will not be able to cross. For the female sterilization now, it's a surgical procedure that is effective at 99% as well. What is it now? It is involving in cutting this tube. This is the uterus, this is the vaginal canal, and here is in the uterus inside. When the ovary lays the egg, the ovum, normally it should be transported towards the uterus inside. And if there is sexual contact and it is during the time of fertility, then the conception is highly possible. So to prevent it, if you want to do contraception, then you need to block both tubes, left and right. The tube is cut and the proximal part and the distal part, all of them are tied. Okay, so there is no way now egg will be able to move from here coming to the uterus. Another mode is intrauterine device. This one is a procedure which aims at inserting these small devices. There are two types. There is a copper intrauterine device and there is a hormonal intrauterine device. So what they do, they cause some chemical changes, okay, and they interfere with the sperm penetration in the uterus inside. So they work by what? Thickening the lining of the inner part of the uterus. You can see it is here. This is a copper T. It is having a shape of T. It will be inserted through the vagina. It comes entering the cervix. It will be placed here and it will just remain here, painless. It just leaves strings outside in the vaginal canal that will be used when you want to remove it. You pull it out. Implant. It's another small rod that is placed most of times on the arm so that it can prevent what? Conception. It will be releasing hormones. It is very effective at 99%. It will be causing what? Thickening of the cervical mucosa. It will be thick, the mucosa, so that it can even interfere with implantation. Okay, so this is how it will be looking like. It's not big, it's too small, and the insertion does not take many minutes. You approach a healthcare worker who is trained, who knows how to do it. He will put it for you, and when you see under the derm, you can see under the skin when it is placed, and it will continue to release hormones progressively. Thank you for part 1. Part 2 is coming, where we are going to see now all of the 12 modes or methods of what? Contraception. Don't miss it. Part 2 is coming.